Hello, this webinar is being recorded. If you have any objections, please disconnect at this time. Thank you very much, and on behalf of the National Cancer Institute, I wish to welcome everyone to today's Implementation Science webinar. Before we get started, I'd like to make a few remarks about the logistics. All lines have been muted upon entry and will remain muted for the duration of the webinar. We encourage questions and comments. Questions can be submitted using the Q&A panel on the right-hand side of your screen. Feel free to submit your questions at any time throughout today's conversation. We will be using the chat panel to share resources. Please note you may need to activate the appropriate panel using the menu options found at the bottom right of your screen. For better viewing of today's speakers, we recommend navigating to the View menu in the upper left-hand corner of your screen and select Hide Participants Without Video. With that, I'd like to turn it over to Dr. Cynthia Vincent. You're muted.
Never fails. Always end up forgetting to unmute. Good afternoon. My name is Cynthia Vincent, and I am a senior advisor on the implementation science team at the National Cancer Institute. And I would love to welcome you to our September Implementation Science webinar. I am so excited that NCI and our partners at the Centers for Disease Control and Prevention are able to co-host this webinar celebrating the 20th anniversary of the Cancer Prevention and Control Research Network. We have been partners on this network since it began, and I'm happy to say that I have had the honor and privilege of working with this network since 2002. Today, we are going to take a look back at what the CPCRN has accomplished in these 20 years. We're going to learn a bit about what they're currently working on and discuss where the work of this network is moving to in the future. We're also going to be providing you an opportunity for you to ask questions to members of this network about their work. So with that, I would like to turn things over to my colleague at the CDC, Erica White. Erica, take it away.
Thank you, Cindy. Can you hear me?
We can.
Hi, good afternoon, everyone. I'm Erica White. I'm an epidemiologist in CDC's Division of Cancer Prevention and Control within the Epidemiology and Applied Research branch at CDC. I currently serve as one of the project officers for the network, and I've been involved with CPCRN for about 8 years. I would like to take the opportunity to welcome and thank you for joining us as we celebrate the 20th anniversary of the Cancer Prevention and Control Research Network. CPCRN was created because, as we all know, disparities persist in incidence and mortality despite advances in cancer prevention, early detection, and treatment. And to reduce the burden of cancer, especially among those disproportionately affected, CDC's Division of Cancer Prevention and Control collaborated with NCI's Division of Cancer Control and Population Sciences to establish CPCRN in 2002. And since that time, this network of academic, public health, and community partners has worked together to accelerate the adoption and implementation of evidence-based cancer prevention and control strategies in communities. And there has been a special focus on the unmet needs of populations at higher risk of getting cancer and dying from it. And so today, several principal investigators from the network will highlight successes, discuss current works in progress, and explore areas for future research and practice. We thank you again for being a part of this celebration of the many accomplishments of this network over the past 20 years. And now I will turn it over to Dr. Jennifer Lehman.
I'm Jennifer Lehman, and I am a professor in the School of Nursing at the University of North Carolina, Chapel Hill. And I have been with the network for over a decade and currently serve as principal investigator of our coordinating center or collaborating center.
Excellent. Let's go ahead and have Chow go ahead and introduce herself.
Hi, everyone. I am Chao Chun Chevron. I lead the New York City Cancer Prevention and Control Research Network Center. I'm also a professor of population health and medicine at the NYU Grossman School of Medicine and associate director of community outreach and engagement for our NCI designated comprehensive cancer center. My work specifically over the last 20 years has been focused on reducing cancer disparities and health inequities among limited English proficient and racial and ethnic minoritized communities in New York City. Our CPCRN is a newcomer to the network. We joined in 2019.
Excellent. Daniela.
Hi, everybody. My name is Daniela Friedman. I'm Principal Investigator of the South Carolina Cancer Prevention and Control Research Network. I'm also Professor and Chair of the Department of Health Promotion, Education, and Behavior in the Arnold School of Public Health at the University of South Carolina. I first became involved with the CPCRN as co-investigator back in 2009. Then I was invited to serve as co-principal investigator with the PI, Dr. James A. Bear, in 2010, and have stayed in the PI role, until 2013. And then from 2013 forward, have been in the PI role. So different roles over time, and have been thrilled to be a part of this network. Thank you.
Excellent. And last but not least, Stephanie.
Hi, everyone. I'm Stephanie Wheeler. I am Professor of Health Policy and Management at the University of North Carolina, Chapel Hill, Gilling School of Global Public Health. I'm also the Associate Director for Community Outreach and Engagement for our Lineberger Comprehensive Cancer Center. And I have been serving as PI of the Coordinating Center here at UNC for the network for the past 5 or so years. I joined the network as an investigator back in 2012, I think, and then took over the PI of the Coordinating Center role, again, about 5 years ago from Brian Weiner, who was the PI prior to me. And I think I'm going to transition now to a couple of slides, not too many, but I wanted to provide a little bit of the history of the network for those of you who are unfamiliar, if Anita can pull those slides up. Thank you, Anita. So first and foremost, here's how you can get in touch with us at the Coordinating Center. You can find us at cpcrn.org. You can also find us on Twitter at CPCRN and you'll have the contact information for our project director, Becky Lee, as well at the end of these slides. Next slide, please. As Erica already mentioned, this network has been consistently funded by the CDC for 20 years with support from the NCI along the way. And this is the largest and the oldest thematic research network that is supported by the CDC-funded Prevention Research Centers program. So this is one of the flagship thematic research center program efforts from the CDC. And we've had over 600 members involved since 2002. And UNC has held the Coordinating Center since 2004. Our mission, as you can see here, is really to accelerate the adoption and implementation of evidence-based cancer prevention and control strategies with a real focus on communities and those with unmet needs, as Erica shared. And we are also very interested in deepening our understanding of the processes of implementation and developing the workforce. So you'll hear more about that in just a few minutes in terms of our specific roles in scholars development and community capacity development. Next slide, please. Over time, as you can see, we've had a wonderful group of network centers that have served in the collaborating center roles. This is currently the 5th round of consistent funding from the CDC. And you can see over time, the membership has changed just a little bit. And our current members are represented here on the farthest side in the current cycle, 2019 to 2024. Next slide, please. And this network map shows where those centers are located. So you've already heard from our PIs at the University of South Carolina, the University of North Carolina, and NYU CUNY, collaborating centers there. We also have collaborating centers at the University of Washington, University of Arizona, the Colorado School of Public Health, University of Iowa, and Emory. And I just want to note that one of the things that we've really done in the past few years is focus on expanding our network affiliate memberships. And so these are individual people who have an interest in the science that the network produces. And these folks can apply for individual affiliate membership. And so each of those little stars, those green stars in the map, represent folks who are part of our affiliate network all across the country. And then the white squares represent where we currently have scholars. And you can see that we're broadening our international reach in the network, and we currently have a scholar based in Switzerland. Next slide, please. These are our network PIs. Some of them are on the call, and some of them you may represent or you may recognize, and they represent centers all across the country again. And I just want to call out our current co-chairs of our steering committee, Dr. Cindy Thompson and Natasha Askelson, and you'll hear more about the steering committee structure in just a minute. Next slide, please. So one of the things that we pride ourselves on is the rich expertise and the diverse expertise represented in this network. So one of the things that we have done over time is survey our network members to understand not only the content and methodological areas of expertise that they have, but also the partnerships that they work closely with. And so this is an example of one of the products of our network surveys of our members to try to understand with whom these investigators are partnering. And so this is just one of those maps. We use Kumu to show this, and it shows the types of providers that CPCRN members are currently partnering with. In this case, you can see that we have really strong partnerships with federally qualified health centers. That's the number one, the large set of partnerships in the bottom right part of the screen. We also have really strong partnerships with hospitals and large health systems, as well as rural health clinics and community cancer centers. We also build maps like this to understand the disciplinary areas of expertise as well as content area expertise. And if you'd like to take a look at those, I encourage you to go to our website and take a look at the Kumu maps and our investigators' areas of expertise there. Next slide, please. We're structured in what I would describe as a very democratic way. We have a shared leadership model whereby together in our steering committee, the PIs of each of the collaborating centers come together with the coordinating center and our federal agency partners at the CDC and the NCI to jointly determine our shared priorities and the directions of our work groups. And the work groups are really where the action of the network happens. That's really where the science gets produced. So you can see here that we have our federal agency partners, the coordinating center, the collaborating centers, and all the affiliates contributing to the steering committee, and then together we determine what the work groups will look like, and the work group leads then are setting their priorities in the form of work group charters, and they have their own structures in terms of who leads each of those work groups and the types of products that they're working on. Next slide, please. And here are some of those work group activities. So we have, as you can see, a lot of things underway in the network. If you want to learn more, we encourage you to take a peek at our website. Lots of information on the website. We have a focus on health equity, a focus on health behavior, organizational theory, understanding social deprivation measurement, organizational readiness. You name it, a whole host of things are of interest to our network members. In a variety of different spaces that are pertinent for cancer prevention and control. I won't have time to go into any of these in great depth, but we encourage you to reach out to us to learn more. Next slide. And just a peek at the impact of this network over time. We have produced over 2,000 publications. This network has been leveraged to acquire more than $700 million in external research grants. We've presented very widely, both nationally and internationally. And we have conducted and hosted a number of training and educational opportunities, one of which you're going to hear a lot about from Dr. Lehman in just a few minutes as we try to build capacity in the community. And I've just presented a couple of examples of some of the ways in which we've tried to achieve impact through this network below. Next slide, please. We welcome collaboration. For those of you who are interested in getting involved, I encourage you to take a look at our affiliate membership program as well as our scholars program. Both of these are currently open for applications. You'll hear more about them in the next few minutes. And we certainly welcome the opportunity to engage with you further after today. Last slide, this contains our contact information and ways to get in touch with myself or, again, Becky Lee, the director of our coordinating center. And I'll turn it back to you, Cindy, so we can open it up for questions.
Thank you very much. And I'm loving seeing the chat. There are so many people here that I have known over the years and that are currently engaged in CPCRN. I feel like I've grown up with a lot of these people in the CPCRN, which is wonderful. Throughout the talk here, if you have questions for anyone or you would like to share anything about your experience in the CPCRN, we encourage you to use the chat. So my first question for the panel is, each of you came into the CPCRN at different times. We've got some folks that have been around for close to the beginning and some that have just joined. But if you can think back to when you joined the CPCRN, what stood out to you about this network that might be different from other networks that you have been involved in? I'm going to go ahead and I'm going to ask Erica from CDC.
Well, sure. So my participation began when I was invited by the CDC lead project officer at that time, who was Dr. Vicki Bernard, to participate. She mentioned that this network did a lot of work around reducing cancer health disparities, and that was an interest of mine. So that definitely piqued my interest, and also the fact that it offered the opportunity to learn more about community-based participatory research. So that's how I initially got involved.
How about you, Jennifer?
Okay, I joined CPCRN when I was an assistant professor and just beginning my career as an implementation scientist, and was very struck by the how welcoming the network was, the many opportunities to engage in collaborative work. It gave me the opportunity to meet people across the country who were doing implementation science. I got to meet Maria Fernandez and Kama Scaffrey and to collaborate with them and to learn from them. And now as a professor, I make a point of if my students or colleagues, new assistant professors have related interests of engaging them in the network. And they invariably have had a similar experience of building their own networks and their own expertise and knowledge through their participation.
Thank you. Daniela.
Ditto to everything that Jennifer just said. And I was thrilled when James Bear invited me to be part of this network and mentored me and invited me to meet the other PIs. I had mentors where I was in South Carolina to see the opportunity, to have the opportunity to engage with mentors at all of these institutions and people being willing to talk to you and to mentor you. That was something that stood out to me. Also seeing how willing people were to share their experiences and their initiatives. So we have a community mini grants program. We learned everything about how to implement a community mini grants program from Emory University. And they were willing to share. And now we have our program, which we have adapted and now willing to share, our adapted program. And so seeing that, the mentorship from faculty and then the sharing of resources was something that was tremendous and something that I noticed right away when I joined the network.
Thank you. How about you, Chow?
So, yeah, I was just thinking about that. I was so excited. Our center is unique in that it's very focused on a large major urban center, urban populations. And the richness and diversity of the other centers, who many of them are serving reducing cancer disparities in rural communities, also other centers focused on the suburban areas, offered this richness of perspectives in terms of the diversity of geographic contexts, diversity of population served, and even approaches. Yet there were common themes that were centered around engagement, community engagement, centered around equity, that I think provided a very unique opportunity to think of the fuller context of what we're trying to do as a network to reduce cancer disparities in the cancer burden within an equity and within a health equity framework.
Thank you. So that's given us a little bit of a flavor of what you started with. So each of you have mentioned a little bit about the work that you've done in the network. Can you share a little bit about something that you, either within the network or within your center, have worked on in the past that has really had meaning for you, that's something you would love to share with other people about this network? Jennifer, why don't you go ahead?
So one of the work groups I got involved with when I first started was the Capacity Building Technical Assistance and Training Work Group, or CPTAT for short. And that work group was trying to understand what kinds of supports and would be needed to build the capacity of our community partners, both clinical, public health, and community-based organizations. So they did formative work to understand what the capacity needs were, and then they developed a curriculum. And that curriculum is called the Putting Public Health Evidence into Action curriculum. It is available on the CPCRN website, and it has evolved over the years, and I've continued to stay engaged with it over the years. It is built to, it's a curriculum that I really like. Calling it a curriculum isn't really fair. It is built around tools participants can use after they leave the training to actually assess their context, to engage their stakeholders, to select an EBI, to adapt it, to implement it, and to evaluate it. And so in its current version, it's a 6-module curriculum that is available on the CPCRN website, where you can access both PowerPoint slides and you can access the tools, the ready-to-use tools that the curriculum is built around. One of the innovations recently that I'm excited about is that we have videotaped CPCRN members delivering the curriculum and created a YouTube channel so that you can access and actually see what it looks like when someone delivers the curriculum. And so we've delivered this widely and have you're welcome to access those materials, and that's something I'm excited about.
Excellent. And I think there's a lot of people on the call that in the past, over time, have been involved in that work group and the current work group. So it's wonderful to hear how it's evolved over time. Chow, you're new to the network, but is there something over the past few years that you would love to share?
Yes, absolutely. I'm really excited to share that. Well, actually, in early 2020, at one of our annual meetings, under Stephanie's leadership, she facilitated this conversation around how do we collectively strengthen the network's vision, its strategic plan, and the discussion evolved around centering the work that we do much more in a much more cohesive style around equity and community engagement. And ultimately, one of the things that we did as a network was to establish a health equity work group, which I co-chair with Prajakta Atsul from the University of New Mexico. And this health equity work group is focused on building capacity within and across the network to further research and programs focused on advancing equity in cancer prevention and control. And one of our first major endeavors was to employ this reflective, mixed method consensus building process, working with network members across all of the core centers, as well as our affiliates and our community partners, to identify and distill core guiding principles rooted in health and racial equity, social determinants of health, and participatory approaches. And these principles also align with the work that we do across the network in dissemination and implementation of research. And so as we began work and engage in this process of identifying core guiding principles, we also found ourselves immediately situated in a very unique time in American history, both with the onset of the COVID pandemic, the realization that social determinants was also very much connected to COVID disparities, we saw the emergence of the Black Lives Movement, the rise of anti-Asian violence. And so we were seeing all this occurring in terms of public health crises, political upheavals in the landscape as we were thinking through our own equity principles for the network. So the context was very unique, and also it really made many of us across more intentionally on the role of social determinants, the role of racism on health, the intersectionality of different social positions, and the complexity of those factors and what we hope to achieve with respect to reducing cancer disparities all across our different geographic and community contexts. And so as a network, I think we started to think through what are the tools and trainings and technical assisted programs do we need to help facilitate cancer research and translation within the lens of health and racial equity. So for me, I thought that was an incredibly exciting time. And I think many others also agree with that. And so we're undertaking this major endeavor. We went from an interest group to a full-blown work group because there's so much interest across the network to really advance equity in the work that we do. So some of the activities that we are undertaking as a network and as a work group is to really refine how we measure our progress and impact in equity, improving data collection processes, even how we're training and entering the next generation of scholars, re-examining our own work with respect to research design and implementation, and even also assessing how we're involving communities as partners in the research process. So I think it's been a really exciting time to be part of the network, to think through this in a very intentional and cohesive way, and also to be more conscious and intentional in the future in terms of how do we integrate and our collaborations into our training.
Thanks. And I think one of the things that excites me about this is also the opportunity. You mentioned that Prajakta is a co-chair. Prajakta is an affiliate, so she had the opportunity to actually co-lead something within a network, which I think is kind of unusual in a network setting, to have someone who's not necessarily been funded originally to be able to step into a leadership role like that. Thank you. Daniela, what's something in the past that you would love to highlight?
I have a whole list, but I'm just going to name a couple of items because I know you're going to ask us about what we're currently excited about. So our site here in South Carolina has been very focused on community engagement and community-based participatory research, which I don't think was initially with this network a huge focus. And I love that we've moved in that direction, and also with the focus on community as well as health equity, as Chow just mentioned. I mentioned our mini grants program, and we have been very excited about this program. Again, with Emory providing us with the example protocols and processes that they've used. And this has involved providing funds to community and faith-based organizations for them to implement evidence-based strategies and interventions. And we always say, how do we sustain something like a mini grant when the grant ends and the funds run out? What has been amazing, and I'm knocking on everything, is that our partners and our grantees have stayed with us since the inception of CPCRN through leveraging other funds, through maintaining partnerships with us by serving on advisory councils, and by participating with us on other grants that I am sure that we were more competitive for because we had a CPCRN collaborating center. And so we've been very proud of our mini grants program. We call it the CHIP Community Health Intervention Program, and we currently have a call out for future CHIP applications. Something else that we're very proud of is our farmers market. Where was the farmers market that was implemented? In the parking lot of a federally qualified health center. I cannot take credit for the farmers market. Dr. Darcy Friedman, Dr. Heather Brandt, Dr. James A. Bear, and many, many others really had the vision for the partnership with the federally qualified health center, with local farmers. And what were providers giving prescriptions for? Fruits and vegetables. And so we looked at health outcomes, we looked at patient-provider communication, but that model was featured regionally, nationally, and there is a farmers market manual, a documentary that Heather Brandt and colleagues developed based on the experience of the farmers with the farmers market. And so to be able to do something so creative as it comes, as it pertains to implementation science for cancer prevention and control, and to partner with the community in the parking lot of a clinic is something pretty amazing that always comes to mind when we think of our center, the past of our center. But people are still talking about it, and getting ideas from the other centers funded on how to do this was really, really key for us. So I'll share those two experiences.
Thank you. I love all of the sharing that has gone on with this network, and Stephanie has chatted about that. And I think that those are really great examples. I think the Community Grants Program is a wonderful example of how it has spread across not just CPCRN, but other organizations on how to do community grants. So kudos there. Stephanie, mentioning your chat, what have you done in the past that you would like to highlight?
Sure. I might take it a little bit of a different direction. I love the stories that my colleagues have shared. When I started in the network, in some ways I felt a little bit like a fish out of water because I was coming in as a health services researcher. I was trained by economists, and I was surrounded by behavioral scientists, and it was like, am I in the right place? But they welcomed me with open arms, and I quickly learned that this was a very warm and open network, and I had much to learn from behavioral scientists and CBPR folks and interventionists, and my whole research trajectory changed, I think, as a result of being engaged in this network. One of the first projects that I got really involved with other centers on was some work we were doing with colorectal cancer screening modeling. And with Brian Weiner's support, I presented some of the simulation work that we were doing, leveraging statewide data. And some colleagues at Oregon Health and Sciences University took interest in that, as did some colleagues at South Carolina and the University of Washington. But it was folks at the University of, Oregon Health and Sciences who had similar data and were able to work in parallel to us at UNC and build a similar set of models and similar structures, and we were able to collaborate. And it's been, 10 or 11 years now that we've had this wonderful collaboration with that group, and it's grown over time and spun off other projects. It's spun off K Awards and new grants, and I'm just really thankful for the opportunity in the network and the vision of the network leaders early on to be very multidisciplinary. And I'm also grateful, at the time Lisa Richardson and Florence Tanka at the CDC were our funders, and I think they were the ones that kind of prodded me to engage more formally with this group, and it's just continued to be the gift that keeps on giving in terms of the science and how our science has evolved. The other thing that I will say that has been true to me, and I'm going to speak to the personalities in this network for just a minute. If this network had a tagline, it would be no ego, because there isn't ego in the CPCRN. It is a team-based model, a collegial model, a collaborative model, a giving model. People's careers are just grown and fertilized here and nurtured here in a way that is unlike anything else that I've seen. The personalities and the investment in the relationships is really quite unique here.
Well, and I think that's a credit to everyone who's been engaged and how the coordinating center has worked through this to really make this an open environment. But I agree, it's a wonderfully open network. I'm going to switch gears to the present, since this is the past, present, and the future. And I'm going to ask Daniela, you're doing a lot. You're doing stuff collaboratively across the network and within your center. What's something you're working on right now that really makes you excited and kind of makes you want to get out of bed and go to work every day?
I'm gonna give one answer this time. I think I gave too many last time, but I'm going to talk about our CPCRN Scholars Program, which is really, really exciting, and I'm hoping that people look into it. if you haven't heard about it yet. So I've been fortunate to be involved with some other CDC thematic networks, and that has been tremendous to be able to do work across networks also. And so the other networks were the Healthy Aging Research Network and the Healthy Brain Research Network. When I was part of the HBRN, so that's the Healthy Brain one, we did establish a scholars program, and I do want to give the HBRN credit for that. It was focused on students to increase their knowledge and research skills focused on cognitive health and aging. And we had 41 student scholars in that program. We didn't establish it right at the beginning of that 5-year grant cycle. It was more toward the end, but we learned a lot of lessons that can be applied to other thematic networks. When CPCRN was funded again in 2019, we've already gotten so good at involving people in the network and affiliates and students and other researchers. And I thought, and how can we do this more formally and establish a formal scholars program guided by the experience that we had in the other network? And so with Thomas Goffrey at Emory University, we presented the idea for a scholars program in January 2019. And I was thrilled. There was excitement about this program, great interest in expanding it beyond students to also include postdocs and researchers and practitioners. And engaging practitioners through the support of our affiliates has been a key goal, thinking about this type of program for CPCRN, because it is the practitioners who are on the ground doing the work in implementation science, our key partners. And so including our agency and clinical practitioners in this program has been really important to us. Also bringing diverse voices, perspectives to the network, having this scholars program really helps us do that. So we were very excited to present this idea. I won't say that the idea was fully hatched out at that point in time, but soon after that meeting, we established a planning group that included investigators, students, staff, affiliate members, and federal agency partners. And Cindy, you were on those calls, and Erica. We also did interviews with potential scholars, people who we thought might be interested in a scholars program to learn more about implementation science focused on cancer prevention and control. We did about 16 interviews. What would they want in a program? And based on that, and based on all of the input from our work group members, we put out a call for applications, and our first cohort started in January 2020. We are finishing up the second year of our scholars program next week. So our first year, we received 24 applications and we had 20 scholars. And this past year, we had 20 applications and 17 scholars accepted. And for the upcoming year, we already have 34 applications and counting. And I'm hoping after this call, we have even more. Our first year, we had 1 practitioner scholar. Our second year, we had 6. Just to give you an example of how we're growing in the diversity of our scholars. Project topics have included scoping reviews of interventions, implementation of evidence-based strategies. So our scholars are doing really unique and interesting things. The curriculum involves webinars, networking, mentoring, projects. I could go on, but I will stop. And before I do, I want to give great credit to Dr. Thomas Goffrey from Emory, our entire scholars work group, and the evaluation committee. We have also done baseline and exit surveys and interviews with our mentors and scientists to get their feedback on the program so that we can keep improving it. And of course, most thanks to Sam Noblet in South Carolina, Courtney Patagna at Emory. They are our project coordinators who keep everything going for the scholars program. And as Stephanie said at the beginning, we have gone international with a scholar in Switzerland, and we have applications from other countries as well in this round. So I am thrilled that we were able to take a new model from another network to expand it, make it our own for CPCRN, and adapt it. And thrilled, I can see some comments in the chat to the side of my eye, and I'm excited that we have scholars here as well. So I'll stop there and we can have questions after.
Excellent.
If people want to learn more.
in lieu of time, I want to make sure if you have questions for anyone on this panel, please put them in the chat. Otherwise, I'm just going to keep asking questions because I love hearing about the work that's going on within CPCRN. Chow, what's something from your center or some of the work groups that you're working on that you're really excited about right now?
So just in terms of thinking about our center, we are currently doing implementation research to evaluate best practices around community health worker facilitated cancer patient navigation, or EHR-based practices to improve cancer prevention and cancer screening. And as I mentioned, in the context of doing the work around the health equity work group, and also realizing the role of social determinants, and then also seeing the impact of COVID on food insecurity and food access, our work has evolved at the same time to think through how do we improve cancer prevention, how do we improve cancer screening, for example, by tackling social determinants of health, by improving, for example, food access or food security, or reducing the experiences of racism in the healthcare setting. And so our center began, because of the network, began to think through sort of a deep dive around this, around tackling, improving cancer outcomes through a social determinants of health approach. And in that effort, in that work, we actually received a grant from the CDC to further that, to test different strategies to improve cancer screening outcomes for breast, cervical, and colorectal cancer by improving food access and by reducing the experience of racism in healthcare. And it also gave me the great pleasure to continue working with Erica and Mary White and Sue Sabatino in a different way, but yet still be involved in the network. So I feel like that became an offshoot of what we were doing within the CPCRN network, just deepening our work very intensely.
Excellent. Congratulations on the grant. And I love hearing about the synergy. Jennifer, what are you working on currently? You're on mute.
One of the other work groups that I've been involved with is called OTIS, which stands for Organizational Theory and Implementation Science. And that is co-led by Linda Coe and by Sarah Birkin, who is an affiliate member. So another example of how we have extended the network. And the purpose of that work group, which has been in place for a while, and you can see Sarah present on it at the D&I conference in Washington in December, is a lot of implementation science has been heavily informed by behavior change theory. And so this is an effort to see if we can draw more on organizational theory. And so the work group has reviewed classic theories, developed templates for those theories to try and translate them into a format that will be more usable for implementation scientists. And those templates are available on the CPCRN website. And we are continuing that work in a number of different ways.
Excellent. Stephanie, how about you?
So I'm going to talk about one of the core projects, actually. So I'm an investigator with our collaborating center, and we have been partnering with folks at the Fred Hutchinson Cancer Center, as well as University of Washington, on a pharmacy-based fit kit distribution program. And that has been, just really lovely as we work together some of the challenges with implementation together. They're based in Seattle, so they're dealing with urban populations primarily, and we are reaching out to rural populations and really thinking carefully about some of the issues Chow raised in terms of equity concerns, but thinking through pharmacies in the COVID era as an increasingly important health service location for many patient populations who aren't able or willing, or who just aren't usual visitors to healthcare clinics. There's many, many, many things that can be done in pharmacies, and pharmacies, of course, are ubiquitous, and community pharmacies in particular have greater reach in some populations than primary care does. So we've done a whole host of qualitative and quantitative methodologies with that group, and I'm excited about what that's yielding. We started a pilot of this program, and it's been fascinating because we've been learning from the HPV vaccination and pharmacies experience and some of the work that Robin and Heather and others had done in the network years ago, Karth Shah, Noel Brewer, and a whole host of others. And I think the dynamic has really changed with COVID. Now that so many health services are increasingly being seen as potentially acceptable to be received in pharmacies, it's like the healthcare delivery environment itself and the acceptability of the pharmacy is quite different now than it even was 5 years ago. So that's one of the things that I think is exciting.
Excellent. So we've got about 12 minutes left. I would love for you to kind of think about if you had a crystal ball and you've been involved in the network, and this network has evolved so much from when it was first started 20 years ago, and it's going to continue to evolve, which is wonderful. Where do you see this network going in the future? I'm going to ask Daniela, and what would you love to see happen with the network?
Something that was so exciting this past year at on a virtual call for the entire network was having a panel of community partners present. And we have had community partners and students and stakeholders attend meetings before. Our key partner with the South Carolina Primary Healthcare Association often traveled with us to meetings. We had one of our community grantees from a faith-based organization present on that panel this past year, and with other panelists from other states, other partners that other PIs had recommended. And I would say that was probably one of the most meaningful conference sessions, webinars that I've been part of in a long time. And we are moving in that direction of really engaging partners, and even more so with this network. And so I don't have the crystal ball, but I can see that. I see the benefit of that for us to get their perspective, but also to see her as representing her organization, to see that the work that she has done, the impact that it has had on this national network, for her to see the work that she is doing in the community, that it is known and it is recognized by an entire network funded by the CDC with NCI partners and others. I think that was just a fantastic thing. And so I think we are going to plan to continue doing things like that. I commend the coordinating center and the steering committee leads for having that vision to have a session like that. And I think that was extremely meaningful. And with the increase in the work that the network is doing in health equity and social determinants, and knowing that it's our community partners and partners on the ground who are in that and doing that, I can't wait to see what the network does next to include them and to highlight them moving forward.
Excellent. Well, we have a question from Prajakta. Thank you, Prajakta, always putting in thought-provoking questions during these meetings. Her question is, in some conversations, investigators have asked about involvement with large research networks. She wants to know if anyone on this panel can comment on some of the benefits that you can mention about such investigators. It feels daunting to think beyond when many scientific models tell us to focus on individual independent research centers. These early career investigators, would love some feedback on this. Anyone want to take a stab at that?
I think it is a caution. It's a legitimate caution that it is like stepping into a candy store, and you can get overwhelmed with the number of different things you can get involved with. So like anything, it's a matter of balance, is figuring out what is going to be most meaningful for you to be involved with, fully engaging in maybe one work group as an early investigator, so that it doesn't detract from moving yourself forward. But I think the benefits of the networking with others across the country are invaluable.
Yeah, it reminds me of advice to anyone in a postdoc that it is like a candy store when you first start in and you've got all of these wonderful things that you want to work on, but you have to keep in mind where you're heading. So trying to keep yourself on track that way, but being able to network with the fabulous investigators here and the affiliates and the community partners, I think is invaluable.
One thing, Cindy, I might just quickly add to Jennifer's comments. I agree that it's helpful for early career investigators to choose maybe just one at max 2 work groups that they would engage in. I would also encourage them to try to identify 1 or 2 products, like a deliverable that helps them meet their goals for promotion and their expectations that they can focus on as well. Because, you know, sometimes, especially when these collaborative networks are trying to decide what products to focus on, there can be a lot of meetings where there's a lot of talking and sorting out, you know, how do we want to organize ourselves and how do we want to prioritize. And those are, I think, the meetings that early career investigators may feel like, well, is this a good use of my time? But I think often in those situations, it's possible to carve out, you know, a scoping review or a smaller analysis, an ancillary study that is very achievable by an early career investigator that then they can lead and help, you know, make their marks in terms of what they need for promotion and advancement. So I think some of that's being strategic. Also coming to us as some of the people who've been in the network for a while, we can help mentor and work that through and think through like how to get what you need out of the network while also taking advantage of the vast networking opportunities that there are.
Thank you. And thanks for those that are making comments about this as well. Stephanie, while you're on the spot, what would your crystal ball say about the future of the network?
I think we should ask Erica that question. CDC has the money. No, I'm kidding. I think that one of the things that I hope we'll do more of as we move forward is think about how the network can advance policy change. This is really difficult to do, as we've seen, and I think maybe even harder after COVID, as we've seen public health and policy kind of be at odds at times. But I think there's tremendous opportunity there for the science that we're producing in the network to have an impact on not just practice, which we know we can have an impact on practice, but really starting to move the needle on policy as well. So I hope that that's one direction that we can move into.
Excellent. Chow, how about you? Where would you love to see the network move?
I could see that we would do more work around multi-level intervention strategies. I think that there are many of us who are doing interventions at an individual or interpersonal or even at a family level, but we could even move the work further at a neighborhood level or even to think through the system level factors that we'd want to change and see whether or not it has any bearing on improvements in cancer control. And so I think that there are opportunities to be able to do sort of that multi-level, but because of the richness and diversity of the network, to also be able to assess it across different geographic and community contexts. I think that would be a really exciting thing in terms of leveraging the diversity of the network centers and even the diversity of those who are affiliates. Many of us across the different centers are also working with community health workers or peer leaders. And so there's also that opportunity to think through how do we continue to build on community assets, community leaderships for cancer prevention and control. So there's that other piece of thinking of moving our work even further in terms of empowering local communities towards equity.
Thank you. Jennifer.
So I would like to see us, and we've already begun to do this, more kind of networking of networks. And so we're already doing a little bit of exploring with the the COEs, the community outreach and engagement cores in the comprehensive cancer centers? How can we do some networking between CPCRN and those? And then the Moonshot funded centers as well, starting to look at opportunities for kind of building our networks through engagement with other networks.
I love that. And finally, last but not least, Erica, where would you like to see the CPCRN going?
Well,
And this is not a mandate.
okay. Well, I thought all of those ideas were great, and I also would like to continue to see a focus on health equity. We're really excited about the work that the health equity work group is doing by providing the resources for the network to address health equity. And also just research on sustainable solutions for disparities in cancer risk, screening services, and the health and well-being of cancer survivors. All of those are aligned with our division's priorities. And I think the network is well positioned given its strengths in community-based participatory research, expertise in partnerships, and collaborating with communities.
Excellent. And I think the CPCRN has also done a fabulous job of supporting the other CDC cancer control programs,
Yes.
the BNC program, the colorectal cancer program, et cetera. It's been an opportunity to really engage them in that work as well. And I'd love to see that continue myself. I'm going to ask Anita to go ahead and post. There's a document that CPCRN has prepared with all of these resources for those who've stayed on the line. It's a PDF that you'll be able to download so you don't have to go back and capture all of the chat. And I just want to thank each and every one of you. I appreciate the work of this network, and I want to really lift up and celebrate 20 years of fabulous partnerships, the growth of this network over the years, and something that I have personally found very valuable as part of my career. So I'm going to turn it over to Anita and let her close it out. But thank you so much for those here on the call and for those that are in attendance that have been part of this. So thank you very much. And Anita, go ahead.
Okay, well, thank you to our speakers for a great conversation today. As a reminder, an archive of today's session will be available shortly. Thank you again, and you may disconnect at this time.
Happy anniversary.